Okay, okay. دكتور دكتور
حبيبي
براحتكم
نعم.
براحتكم إذا تحبون تبدون.
هسه راح ابدي، بس جاي اجمع لكم صور، بس لحظه واحده.
أي براحتك دكتور.
shall we start?
أوكي دكتور.
انتم عاده السمول جروب شلون تبدون به سراج؟ شنو اللي تقومون به؟
دكتور طالب يقرأ والدكتور يسأل يعني مثلا على السؤال على الكيس أو شيء ويتناقش ويطلع.
اوكي، يعني هو المفروض السمول جروب من اسم سمول جروب يعني يكون
المفروض دكتور
تقسمون الى مجاميع، زين، وكل مجموعه تعطي
نسوي واحد
الانسر
مجموعة.
مالتها.
ما قدرنا.
اي مشكله والله.
أي ما صارت.
زين. يلا اوكي، ماكو مشكله. هسه من يتبرع يقرا السؤال؟
محمد
او
مصعب دكتور عندنا خوش يقرأ كل مرة يقرأ.
يلا محمد ابو جاسم. محمد تقدر تقرا لنا السؤال على مود زملائك يسمعون؟
اي دكتور، بس خل افتح شو اسمه البرنامج.
اوكي.
دكتور أنا نفس صفحة 67 مو 66 في الموديل.
يعني هاي الكيس تبدي ماريا is a 26 years old lady.
يا صفحة دكتور هاي ما جاي يطلع عندي.
ايه محمد 66.
67 ضبط.
67 ماكو شو ماريا ما تطلع عندي، هو نفس الجروب ورك ماكو شو ما تطلع عندي.
محمد شوف خاف بالورك القديم.
زين خلي واحد يعرضه وانا اقرا، خلي واحد يرفعه.
اي واحد غير محمد اذا ما يعني
خلي واحد يعرضه وانا اقرا.
اعرض لك اياه. اوكي. تشوفون السلايد؟ شوف السلايد هسه مالتي الوورد دوكيمنت.
ايه دكتور طلع.
اوكي. هسه واحد من عندكم محمد او اي واحد يقرا لنا
اي دكتور.
اوكي.
اقول Maria is 26 years old, a lady who has been diagnosed with Crohn's disease that predominantly affects her small intestine. She is curious to know why she is losing weight and ask you a series of surprisingly in-depth questions. Describe two factors that encourage absorption in the intestine.
Okay. So, guys, what do you think? Anyone give you lectures about the anatomy and the physiology of intestine? Have you? Okay. So, tell me. I think you are better than me.
السيرفيس اريا يعني تساهم بالابزوربشن. طبعا الفيلاي الموجودة بها، يعني كل ما زاد السيرفيس اريا راح تزداد الابزوربشن.
Excellent. Okay.
what are راح على السؤال ورا.
So she needs to know two factors that increase or encourage absorptions. So I agree with you. We have if we increase the surface area, how do we increase the surface area in the intestine? So حتى لو واحد يجاوب شلون نقدر
دكتور لا يصير مدارس.
Please write on the chat or just one speak. Okay. So microvilli علي كتب. So microvilli, I agree with him. Licca circularis, villi, and surface Muhammad. Okay. Abdul Rahman. So I just need to show you a slide actually. So have you seen the duodenum from the interior? This is the duodenum from the endoscopy view. If you see here, yeah, you can appreciate the fold here, the duodenum fold. And this is the duodenum fold. It's called the plica percularis. So, and the aim of this is to increase the surface area. This is one of the answer to the questions, is to increase the surface area to the absorptions. The slides here also can give you some idea about the how we do increase the surface area. When the intestine formed in order to increase the surface area with the food, in order to increase the contact time. Plica circularis, as you can see, and as you saw in the previous slide here, is the intestine fold, duodenal fold. This is fold like شلون قطعة القماش اللي هي مقسمة إلى fold، شلون الستائر أو من أنت تريد تكثر هذا تسويها in fold in order to increase or decrease the space or increase the space of the area. بعد عندنا الفيلاي، اكو macro villi as you can see here in the do you see my mouse moving?
اي دكتور.
So the villi, this is a macro villi, and in addition there is macro villi inside each villi, and then the intestinal crypts also play a role in the small and the atlas as I said microvilli. Okay, so it is clear there is a number of items that increase the absorptions of villi. This is a clear slide for you to understand the answer. Okay, everyone happy? Okay, so let us go to the another slide, to another question, sorry. So what is the another question? So let another Muhammad.
What are intestinal crypts, intestinal glands?
Okay. So what are the intestinal glands? Anyone can help us in answering this question, even writing on the chat, please. راح ادز لكم السلايدات. Don't worry about the slide. Anyone volunteer to answer this question? Okay, Zainab. Crypts of leprechaun found throughout the length of the small intestine. They are simple to a gland standing through the thickness of the mucous membrane, opening into the intestine lumen at the base of the. Excellent. So Zainab, if you see the answer of Zainab on the chat, is clear. So she said it is are found throughout the length of small intestine. I agree. They are simple. tubular glands extending through the thickness of the mucous membrane and opening into the intestinal lumen at the base of the villi. And within the crypts, Ali, the cell multiply and they migrate to the tips of the villas, maturing as they move. Excellent. So I think this is two answers that can explain the role of crypts. So let me show you another slide. So here the crypts slide. So if you can see, the crypts is present on the base of the villi. So this is a crypt cell, and the crypt cell is called, the crypts is like invaginations. This is the term of a crypts. And the invaginations of the crypts is formed called stem cells, contain the original cell that differentiate to become enterocyte. So crypt cell, as you can see here, it is present in the base of the villi. So, and this is the photo that the invaginations here from the mucous membrane is called crypts. You see my mouse moving. So here is the crypts, while here the protrusions of the mucosa is called villi. And if you can see the features here, the feature on mucous membrane, the photo is not so clear, but on real endoscopy, you can see the villi. If you magnify the pictures to larger than to like 100 pixels or something like that, so you can see the villi appearing on the real endoscopy photos. So the crypts here, it is originated from the base of the villi. As you can see, this is a villi, and the origins of the villi is here. And then the next question, speaking about what is the function of the crypts, I think. Okay.
Hey, Doctor.
So describe the role they play in the renewing the intestinal epithelium. How they do the renewing of the intestinal epithelium. So, anyone?
دكتور ممكن نشرح هذا السؤال؟
So
يعني هي
other words,
cells تتكون بالكريبت وتهاجر بعدين يصير بها ماتشورينج، بس دكتور انه عليها اساس انه هي تتكون، يعني انه ليش تهاجر؟ انه اكو اشارة تجيها او فد كيميكال ميديتر يحفز انه تكوينها والماتشورينج مالتها؟
Of course, Zainab, يعني I'm not sure if I can continue English speaking, but okay, I will try speaking in Arabic. Zainab, لازم اكو فد ميدياترز واكو تريجرز بكل السيلز. الكريب سيل هي ستيم سيل الموجوده بالانتستين، والستيم سيل يعني موجوده بالبون مارو، موجوده بالمسلز، موجوده بكل التيشوز. من تجي هاي يعني هاي الخلايا من تجي يصير بيها differentiations to the cell, to the enterocyte or to the epithelial cell. Of course, there is a triggers, and there is a process of continuing. And in intestine, this triggers happens in continuous way. It is not like other cell when it is mature. As you know, the bone when it grows, it complete maturations within two at the age of 18, while the intestine keep growing each time and keep renewing itself each time in order to to protect or to save her absorption process. So like the skin, when there is injury of the skin, the process, there is a renewing, and there is when renewing and there is shedding of the previous cells. The same things happen in the bowel. So there is very rapid process in order to keep the bowel epithelia is intact and new. So the Krebs cell is the stem cell, like the stem cell present in any organs, in the liver, in the bone, in the skin. So this is what is called the Krebs cell. But it is the origin of the cell that differentiate into enterocyte or epithelial cell, which are responsible about absorptions. So this is the clear answer that you want to respond in order to answer this question. Okay? Do you understand what I'm saying?
بلي دكتور عشتينك.
Okay. So what about the next question?
Doctor, what is the unsteroid layer?
What is the unsteroid layer? Okay. Anyone can help us answering this question? Unsteroid layer. Anyone answer this question, please? I'm waiting for a response. So Muhammad, cells in the brush border are very active and secrete many enzymes which remain between the macrovilli to form unsteroid layer on this partly digest nutrient diffused into unsteroid layer and with digestion and release the nutrient for absorption. Okay.
دكتور يعني قصدي انه هن موجودات فوق البرش بوردر، فشو اسمه الريليزنج مع الانزيم يصير in between them.
Okay. So what I need you to know from the unsteroid layer is just a mucous membrane layer present everywhere throughout the GIT system. So the unsteroid layer is a mucous membrane layer. Its function is to protect the layers and contain a lot of enzymes secreted on the enterocyte and for the digestions. So the clear definitions.
دكتور بس هي الانزيمات ما تنفرز من عندها، يعني تنفرز
No.
يعني.
It is just as I said, it is just a mucous member. It is a mucus. The mucus
واضح دكتور.
is like the nasal discharge during flu. So the mucous is the layers of thick materials present on the surface of the intestine. I got for you really definitions about unsteroid layers, but let me see where I put them. So the unsteroid layer is just the mucous membrane present in the on the surface of the enterocell. This is the mucus layer also promotes formations of fluid over epithelium that protect the mucosa. It has, okay, so I will show you my answer here right now. Just in a second, I will give you copy. Test. So here the answer, I think. So if you see here, so mucin secreted by surface of your cell from a thin layer of mucus that prevent the large food particle from directly touching the epithelium. The mucus layer also promotes formation of anterior layer of fluid over the epithelium that protect the mucosa and has a neutral pH as a result of secretion of bicarbonate ions by surface epithelium. So it is just like fluid layer over the mucus over the epithelium. So it is called anesthered. Anesthered, which is not moving. Mean in Arabic it is not moving, it's not jumping. So this is the clear definitions of anesthered layer. Okay? Happy with that? Okay. So what about the next question? What are the
Doctor, what are the breakdown product of polysaccharides?
Okay.
Monosaccharide.
So anyone can help us?
دكتور glucose galactose fructose.
Excellent. So anyone can give us more thorough answer about the
تشتري البوليسكرايد تصير انه داي وراها انه يصير مونو.
اوكي.
يعني انه يصير بعدين لاكتوز وسكروز بعدين يصير مالتوز وجالكتوز وجلوكوز كنتيجة نهائية فعل انزيمات.
Okay, that's right. Any other suggestion? Can other give us another suggestion about the answer? I agree with you, Zainab, 100%. But let me see the other if they have other comments. No one? So if you can see the photos here on the slide, so the carbohydrate divided into simple and to complex. The simple is called monosaccharide, which are 3, and even 4th some definition. So glucose, fructose, and galactose. Disaccharide is combinations of 2 of the monosaccharide. It is from the name, disaccharide. Maltose, lactose, and sucrose. The polysaccharides is like complications of more than 2, 3, and more, 3 and above of monosaccharides. So it is called either it is starch, fibers, glycogen. This is the symbol like diagram about the monosaccharide. So I think what is the next question? is what are the enzymes involved in breakdown polysaccharide? Where are they released in the GI tract? So anyone can help us answering this question?
دكتور عيد السؤال.
So what are the enzymes responsible to this material, polysaccharide? So tell us about the enzyme responsible about the gradations of polysaccharide and absorption.
دكتور الليفر بنكرياتيك أميليز
Okay.
يبدأ بالهضم، وبعدها من يصيرون دايسكرايد أكو من 4 إنزيمات هم يشتغلون.
Good.
يعني هي حسب المادة، مثلا مالتي السكريات هذني بالداي، بس إنه هنا الأميليز إنهم نفس الليفر بنكرياتيك أميليز يبدون يشتغلون إنه يحولون البولي إلى داي، يعني هذا حسب اعتقادي مو متأكدة.
Zainab, have you taken a lecture about metabolism of?
دكتور بالأول ماخذين.
بالأول دكتور ماخذيها.
Okay, that's good. So I think you have the answer. So you know what are the enzymes responsible about glucose metabolism. Because to be honest with you, this is a basic questions. It is really is not my job as I am a clinician, but I try my best in order to let you know the answer in full. So my job is to understand your level in understanding this question. So I'm not sure if you took full lecture about metabolism of protein and the sugars, and so I'm really happy to hear that you took a lectures about the metabolism of materials, because it is really important for you to understand the physiology and the anatomy of the GIT tract in order to understand the later on the clinical effects of disease and the other factors that involve in the absorptions of materials, because you will not know the disease if you don't know what's happening in the GIT in the normal physiology and anatomy. Okay, so Ghufran wrote amylase hydrolyze the long carbohydrate chains that break amylase down into the disaccharides and glycogen into polysaccharide. The enzyme in the small testing can break these down to the monosaccharides. Excellent, Ghufran. Let me show you one slide that I think is really helpful for you. So let me show you one. So I think I'm a simpler size. This is the simple slide, I think, for you. The amylase that degrade the starch and convert the sugar into disaccharides. As you can see, the sucrose can be digested by sucrase into glucose, 1-glucose and fructose. As you know, sucrose is very sucrase is enzyme responsible for sucrose, and sucrose if be digested into 2-glucose and fructose, while maltose composed of 2 units of glucose and degraded by maltase, lactose by lactase, 1-glucose and 1-galactose. To be honest with you, when I was during my training in Sydney, when we took a biopsy from the patient, from duodenal biopsy, we are able to send about this enzyme level. So when you send a histopathology lab, for a specimen for histopathology lab, so you can able to measure this enzyme in order to know, especially in patients with the bloating, in order to know if there is any deficiency in these enzymes. And we encourage the patient accordingly if we found any one of these enzymes deficient in each patient. So now, but unfortunately, this level of enzyme is not available in our country. Okay. So do you?
Okay, Doctor.
So this is, I think, the enzyme that I'm about the gradation of, and there is more complicated, like algorithm. If you see this here, disaccharides is also, they can give you some photos about, and this is more complicated slide. I don't want you to understand this complicated slide because I think this is large, like upper than your limits. So just stick with this slide. It is easier to know what's happening. And if you want this slide, I will send all this slide for you guys. Don't worry about the slides. So this is a clear evidence about the glucose and the how we graduate glucose from the. And I think if you took a lecture, you are better than me in knowing the absorptions of the glucose. Okay. Okay. So let us jump to the next slides, to the next questions. So the next questions speaking about so describe the path using that if you wish. So okay, so anyone can give us an idea about the absorptions of the glucose from the intestinal lumen to the capillary blood? This is the questions for you. So describe the path using diagram if you wish that glucose takes as it is absorbed from the intestinal lumen to the capillary blood. Okay. Hello guys.
دكتور هو السؤال ما مفهوم هو شنو يقصد به؟
يعني نريد ارسموا لنا دايجرام او شلون الجلوكوز جاي يدخل من اللومن اوف انتستين ويدخل للبلاد فيسلز انسايد ذا وول. شلون بيا عمليه؟
دكتور احنا عندنا سيمبورت يسمونه جلوكوز صوديوم سيمبورت.
That's good. Okay, tell me about that.
هو facilitated diffusion.
Excellent. So
يعني يطب الجلوكوز ويطب وياه صوديوم. طبعا احنا عندنا هذا ال NAKATPase هو اللي يطلع الصوديوم لللومن على مود يدخل الجلوكوز وياه وعن طريق هذا السيمبورت صوديوم جلوكوز سيمبورت. وبهالحاله يصير
you are really answered the question in good. So the glucose, I think the glucose causing when it absorbed usually with the sodium, and this is the basis of answering the next question. As you can see, so here the channels, if you can see, this is the image was cut. The sodium glucose co-transporters. It enters by facilitated what is called facilitated diffusions of glucose. So when the glucose won't enter unless the sodium enter with it through this co-transporter. Okay, so this is what is called facilitated diffusion through. So that is why the answer, this is the basis of the answer the next questions. What is the next questions?
Doctor, list the main proteins present in the GIT and where they are released from.
Hamad, you are reading what?
السؤال اللي وراه دكتور غير؟
السؤال وراه يحكي على oral rehydration solution. Am I right or not?
لا دكتور هذا حليناه.
اي دكتور صحيح، هذا السؤال قبل قاعد يحكي.
قبل الورق هذا، أنا عندي الورق.
هو لا هاي مال oral rehydration.
Why do oral rehydration therapies contain glucose and salt?
دكتور نفس الشيء على مود اسوي ري ابزوربشن للصوديوم، ازود ري ابزوربشن للصوديوم.
Yeah. So many questions.
دكتور اوزموتيك جرادينت راح يصير؟
هو اوزموتيك جرادينت نفس السؤال.
حتى انه يسحب الفلويد.
Yeah. So a lot of question you will receive when you become a doctor and you see a case of diarrhea, acute diarrhea, and what we will give her, what is the fluid that we give her, what we encourage her, what is the diet of her. So if you don't know the answer, you will be in a big trouble. So this is the answer for you when you answering the patients having the diarrhea. So when the diarrhea present here, in any case, so you will encourage the intake of salt and sugary diet. So it is not just salt. That is why the oral rehydration solution contains glucose and salt. Because salt, as you know, the diarrhea is caused dehydrations, and when there is a loss of sodium and bica and chloride, so if you will not able to manage the dehydrations level in terms of fluid and salt, or what I mean by salt is electrolyte, unless you give a glucose within. So that's why all oral rehydration solutions like rehydrate or present, there is a certain formula present outside in the pharmacy. When you go to the pharmacy to ask them about oral rehydration solutions, so it will give you like 2 or 3 types of oral rehydration solution, and all of them they contains glucose and salts. So keep in mind when you encourage any patient like your friends, relatives to take a fluids during the terms of diarrhea. So you have to tell them to take a sugar with the salt. What I mean by sugar is to take like fruit juice with the like a soup of a meat or the بالعامية مي اللحم أو مي دجاج أو مي تمن. This is contain a lot of salts inside. So keep in mind is to give oral in solution contain glucose. So it is not just like salty fluid. Okay, happy with that?
دكتور يا ريت شوي تشرح لنا بالعربي يعني.
اوكي، يعني الفكره من عندها انه
دكتور احنا افتهمنا السؤال بس يعني عجلت بالعربي.
تعطي سوائل بيها. اوكي يلا. List the main protease. So the next question, list the main protease present in the GIT and where they are released from. الآن على البروتيز. منو اللي يشرح لنا what is the enzymes or what types of protease do we have here?
دكتور عندنا بروتيز بالستومك اللي هو البيبسين، وعندنا بروتيز بالانتستين اللي تنفرز من البنكرياس اللي هي التريبسين وكيموتريبسين.
اوكي excellent. Go ahead.
دكتور
So
نذني كسرنا البروتين انت بولي بيبتايد يعني يسموها بيبتون، وبعدين جماعه البنكرياس هم البذن البولي بيبتايد يكسرنها لامينو اسيد.
excellent. I think I give you a short, I will give you like a short. Do you see my slides?
شنو دكتور؟
دكتور مرات تروح وترجع.
تشوفون سلايداتي عافية؟ تشوفون سلايداتي؟
هو اصلا الدكتور طالع الاسئله.
الأسئلة اوكي.
دكتور العفو، اذا تقدر انه من برزنتنج تحوله الى فول سكرين، يعني يسوي برزنت الشاشه كامله على مود ما تبقى تبدل منها يعني بين الباوربوينت والوورد.
اعرف
راح ياخذ السكرين كله فلا يطلع.
بس مو اعرف، بس ما اريدكم شوي. I just a lot of document. I open a lot of document on my screen, so I don't really need to be missed by this a lot of. So just I will show you the brief of what I need to know. I know already this the full screen, but to be honest with you, I don't need you to be missed with the a lot of screen that available on my window. Okay, so the answer here. I will not go through this answer. يعني الجواب انه اكو بيبسين واكو كايموتريبسين بس اذا قريتوا هذا الجواب اعتقد راح تفهمون. The precursor are so called trypsinogen. There is trypsin. التريبسين جاي من التريبسينوجين، وهذا التريبسينوجين راح يحول التريبسينوجين is transferred from to endopeptidase called trypsin by enzyme called enterokinase secreted from the wall of small intestine. Trypsin then activate the precursor of chymotrypsin, elastase, and carboxypeptidase. When the pancreatic enzyme become activated in the intestine, they convert protein into the free amino acids, which are easily absorbed by the cell of the intestine wall. The pancreas also produce a protein called pancreatic secretory trypsin inhibitor, which bind to the trypsin and block secretory. Don't worry about the last two statements. So we have certain enzymes present in the. You can read this and you can understand the situation. And I think يعني اعتقد انتم احسن من عندي بفهم هاي، باعتباركم استوكم ماخذين الفسيولوجي وعندكم full lectures about the physiology and of absorptions of GIT. Just you have to know there is pepsin and trypsinogens, and there is chymotrypsin, elastase, and carboxypeptidase. These are the enzymes responsible about the gradations of the proteins. And this is also answered, this brief paragraph answered the next question, I think, in the So brief describe the breakdown pathway of protein. So I think this is the answer also for the it's not just for the enzyme. Okay, let us go to, because the time ran out, what is the meant by term of segmentation? What are its main purpose?
دكتور mixing.
Sorry?
دكتور mixing of food.
So how it happens, Qasim? How it happens the segmentation? How it different from peristalsis?
دكتور البيروستالسيس يعني المنطقة العليا يصير بها كونتراكشن، والمنطقة اللي جواها يصير بها ريلاكسيشن، بينما السيجمنتيشن منطقة كونتراكشن ومنطقة ريلاكسيشن، وراها كونتراكشن وراها ريلاكسيشن، يعني ماكو نت موفمنت، وانما جاست ميكسينج with enzyme.
طبعا I agree totally with Qasim, because the segmentation is just the aim of segmentation is to mix the food and to increase the contact time with the food. This is the aim of segmentation, as usually happen by circular muscle. present in the intestine or in the bowel. While the peristalsis is caused by the longitudinal muscle, tinea coli, and it is like a wave, starting from the above to the down of the bowel. And the aim of the waving, the aim of this peristalsis is to move the food toward the anus, while the aim of the segmentation is to increase the contact time in order to get the food digested and absorbed. So this is the aim of each of the phalanx. Okay, so happy with that?
Happy Dictor.
Okay. So let us see what is the next questions. What are the longitudinal muscle in large intestine known as? أكو واحد يعرف اسمها longitudinal muscle؟
Tortina cola.
Excellent. So tinea coli. What is meant by mass movement? What is meant by mass movement?
دكتور باعتبار السواد صار لها absorption فيصير كتلة الغذاء يعني تصير أقل حركتها.
دكتور عن طريق الهاستريشن اللي بالهاسترا اللي موجوده باللارج انتستين، يعني تنتقل من هاوسترا لهاوسترا.
عافية. يعني mass movement happens through the large intestine, moving of the large bulk of stool through the
certification تسوي؟
سوري زينب؟
certification تسوي؟ إنه من الكولون للركتم يمكن تدفع حتى يزداد البريشر ويسوي يورج للديفيكيشن.
Yes, the mass movement is it is initiated by gastrocolic reflex. We will speak about this in just a second. So the mass movement here, movement of the الكتلة stool mass into the rectum, and this is caused by the large muscles of the transverse muscle and caused like a peristalsis wave-like, and it's called mass movement, and it is initiated by gastrocolic reflex. What is the gastrocolic reflex, guys?
دكتور لما يصير فود بالاستومك يصير اكتيفيشن للفيجاس نيرف يعني لللارج انتستين يخليها تتحرك، يعني تسوي هاوستريشن على مود تسوي ماس موفمنت.
Okay, so this is mean that it is a reflex caused by entering the food into initiated by taking the food. When the food entered the opening of the GIT tract or the start of GI tract, so it will cause reflex movement of the bowel. So this is what is called gastrocolic reflex. So when the food entered the gastric, the colon start movement. It's a reflex movement. That's why most of the bowel movement happen when any person took a food in early morning. This is when he is normal, doesn't have like lax bowel or slow bowel movement or slow transit time, or he or she doesn't have any problem in the bowel that lead to the constipations. So usually the patients, when he took the food in the early morning, he will have pass motion or pass gases because there is a reflex movement what's called gastrocolic reflex. Okay.
دكتور عيد بالعربي لو زحمة.
يعني هو بمعنى انه انت من تاخذ الفود يدخل للباول للستومك there is movement of the colon because through the nerves and this is not explained just by the nerve stimulations because it is a reflex. شلون ما انتم تسوون بعد كم يوم بالنيورولوجي من تضرب الني تتحرك الليج، هذا احنا نصح له ريفلكس مانوفر. It is not through the افعالكم يا شباب كلها، يعني اكو واحد يشتغل انتم فاهمين معنى الريفلكس شنو لو ما فاهمين؟
اشرح لنا يا دكتور مختصر.
دكتور هو هنا هنا الرفلكس يقصد به شو اسمه يعني بالنيورون بالمسلز، مو يعني بالكتله مال الاكل اللي موجوده.
ترى هو
يعني
سنسر وموتور
يعني مو مثل الجاستروسوفيجال ريفلكس بحيث يرجع الاكل، لا هنا جاي يشتغل عندي المصل والنيورون والهرمونات.
لا محمد لا تروح هذا الجاستروسوفيجال ريفلكس الجيرد هذا يعني
لا هو اكو فرق بينهم.
المقصد على الريفلكس ريفلكس هي معناها كلمه انجليزيه معناها يعني رجوع او استرجاع او هذا، بس انا من احكي عن ريفلكشنز او ريفلكشن هذيك باليو هاي بالاي ريفلكس. زين الجاستروكوليك ريفلكس it is not reflux.
دكتور يعني لا
اكو ديفرنت بالوردز. زين
اي دكتور يعني اكو مو مثل الماس
لا انا احنا لا تروح على فشي it is not our subject. That disease caused by movement of the fluid and the food through the gastroesophageal junction. It is called reflux بالU ما بين ال والX there is U. It is not reflex. Reflex it's mean. Let me explain the reflex for you guys. كل الافعال اللي انت تقوم بها هي تمر عن طريق البرين. يعني البرين يسوي لها بروسيسنج، يلا انت تطبيها اوردر especially when you are a kid. يعني انتم من كنتوا اطفال او احنا من كنا اطفال دائما الاشياء تمر عن طريق اذا انت تريد تتعلم لك فد شغله تمر عن طريق البرين يسوي لها بروسيسنج، يلا يعازل البرين بافعالها. طبعا البيبي عنده certain reflexes يصير راح تاخذوها بالبيدياتريشنز، بس افعالنا وحركاتنا كلها هي not يعني بداياتها هي not reflex. شو وقت تصير ريفلكس؟ الريفلكس ما يطب عن طريق البرين، يطب عن طريق either the spinal cord. زين يكون كل سريع بحيث انه ما يروح يسوي له بروسيسنج للبرين على مود البرين يعطي بها اوردر وديسيجن ويصير بها ثينكينج وتتاخر القضيه يلا يصير بها ديسيجن انه اسوي هاي الشغله لو لا اكو اشياء هي فولنتري بها ريفلكس انفولينتري بها ريفلكس، واكو اشياء فولنتري بها ريفلكس. يعني اضرب لكم مثال على الفولنتري والانفولنتري. السياقه بالبدايه انت تسوق with conscious. زين انت جاي تتعلم انه شلون تلوف شلون تدوس بنزين وهذا. اذا واحد منكم سايق وصار له فتره اذن يسويهن بدون ما يعرف، اذن احنا نصيح هذا صار ريفلكس، هذا بس كان هذا نصيح له كونشس ريفلكس. بس اكو اشياء هي انكونشس ريفلكس، هي الله سبحانه وتعالى خالقها مثل الجاسترو كوليك ريفلكس او هذين الاشياء اللي الريفلكسات الموجوده بالبيبي ذني انفوليونتري ريفلكس هن يشتغلن عن طريق السباينال كورد ما يصير بيهن بروسيس للبرين. زين فهو هذا الفرق. I hope I was good in explanation of it. واعتقد زملائي بالنيورولوجي راح يبينون لكم شنو الفرق ما بين الريفلكسز بالنيورولوجي فولي. سو الجاستروكوليك ريفلكس هو ريفلكس ما يروح للبرين على مود يشغله، لا هو انفوليونتري الله خالقه سبحانه وتعالى على مود يمشي الباول. فمن تاخذ الفود انترديجاستريك شلون ما زميلكم حكي راح يصير ستيميوليشن للفيجل نيرف through the spinal cord through the nerve. It will be stimulated the colon movement, and then the process of defecation started. Do you understand what I mean? Is that clear? Okay. What are the difference between the internal and external anal sphincter? Anyone can help us in answering this question? Anyone, guys?
دكتور الانترنال involuntary والاكسترنال voluntary.
Excellent. So the internal is smooth muscle contained from smooth muscle. It is involuntary, while the internal it is skeletal muscle. It is voluntary.
striatal
Okay.
muscle.
Okay.
Okay.
What is the next question?
دكتور كيس ثاني.
Okay, go ahead and present this case.
60-year-old woman presents to her general practitioner because she has noticed she has become a bit unsteady on her feet over the last month. Prior to this, she had also been slowly and unintentionally losing weight and had noticed that her tongue was sore. Blood tests reveal a microcytic anemia, and the general practitioner wonders whether she has pernicious anemia. Describe classical pernicious anemia. سؤال هو describe classical pernicious anemia دكتور.
So, okay, so who's answering this question?
Vitamin B12 deficiency.
Okay. It is
خلل
just
بالابزوربشن دكتور.
Siraj, it is just vitamin B12 deficiency. She described the classical pernicious anemia. What is the classical pernicious anemia? So I agree with you. It is a B12 deficiency, but what types of B12 deficiency? Anyone can answer.
دكتور هو خلل بالابزوربشن يصير اتوقع هيك.
Why it is خلل بالابزوربشن؟
دكتور احنا عندنا الانترنسك فاكتور هي اللي تساعد بالفيتامين بي 12 ديفشنسي، فاذا صار خلل بيها سواء اوتو اميون او اي نقص بيها يعني راح ياثر لي على الفيتامين بي 12 ديفشنسي، يسوي لي فيتامين
قاسم يعني احنا يعني انت جاوبت السؤال بس ما اعرف السؤال ما واضح لك انه هي انت قلت اوتو اميون pernicious anemia. It is autoimmune B12 deficiency. It is not a B12 deficiency. As you know, B12 deficiency happen in a lot of conditions like malnutrition. واحد ما ياكل لحم، دول اغلبهم ما ياكلون لحم زين فيصير عندهم نقص بالبي 12 زين.
دكتور برايتال فيها دمج.
نعم، فهاي هسه راح نجي نحكي عليها، بس اريد اوضح الكوزز اوف بي 12 deficiency. شنو الموست prominent site for absorption of B12? Anyone can answer me this question? Where is the main site for absorption of B12?
اليوم دكتور.
باليوم.
So terminal ileum is the site of the absorption. So imagine if the patients we spoke last week about the Crohn's disease. So imagine if you have Crohn's disease and the inflammation of terminal ileum, which is the main site of Crohn's disease inflammations. So it will cause B12 deficiency. This is when the features of B12 happen. It's not called pernicious anemia. Pernicious anemia is the autoimmune deficiency of B12 due to antibody attacking the parietal cell. Okay, I need all of you understand this fully. So it's cause usually associated with atrophic gastritis, and this cause B12 deficiency. Okay. So what is the next question, please? Go ahead.
دكتور أنا الزحمة البرايتال سيل شنو لها علاقة بالترمينال إليوم؟
التيرمينال
برايتال
اليوم
سيل هي مو بالستومك؟
زينب التيرمينال بس افتهموك. I think I have to explain that in Arabic because some of you didn't understand me fully. ال B12 يصير بابزوربشن بالتيرمينال اليوم. الاسباب مال البي 12 ديفيشنسي هي مو كلها اوتو اميون، هي مو كلها بيرنيشيوس، مو كل البي 12 ديفيشنسي معناه انه بيرنيشيوس انيميا. البي بيرنيشيوس انيميا هي اوتو اميون ديفيشنسي of B12 اللي happen when there is antibody attacking the parietal cell. البرايتال سيل مسؤولة على افراز الانترنسيك فاكتور اللي هو very ضروري لامتصاص البي 12. زين؟ من اكو انتيبودي اتاكينج ذا بارايتال سيل راح يصير بيرنيشيوس انيميا، لان هذول راح يصير وياهم اتروفيك جاسترايتس وياهم فيتشرز اوف بي 12 ديفيشنسي. نجي على الاذر كوزز، الاسباب الاخرى اللي هي تؤدي الى البي 12 ديفيشنسي اللي هي مثل الكرونز ديزيز. ليش كرونز ديزيز يصير عندهم؟ ما عندهم بيرنيشيوس انيميا اهل الكرونز ديزيز، ما عندهم اوتو اميون ديفيشنسي اوف بي 12، لا عندهم خلل بالتيرمينال اليوم، لان الانفلاميشن اوف تيرمينال اليوم also lead to malabsorptions of B12 راح يخلينا ال B12 ما يفرز. هذا سبب ثاني. السبب الاخر انه اكو ناس هم فيجيتيريان ما ياكلون اللحوم، فذول راح يصير عندهم B12 deficiency. زين؟ فهذول هم ما عندهم pernicious anemia بس عندهم B12 deficiency. I hope I get the point for you guys. So ال B12 له أسباب معينة، مو كل واحد عنده B12 deficiency نصيح له pernicious anemia. Does that make sense for you guys?
واضح دكتور أرسل.
Okay. So let us go to the another question. هسه عرفتوا انه احنا شرحنا خلال هذا انه هذا الجواب describe the normal pathway involved in B12 absorption and how this is interrupted in pernicious anemia. احنا شرحنا هذا لان ال B12 يحتاج له intrinsic factor which is secreted from parietal cell. اوكي؟ فالانتيبودي انتي parietal cell antibody اللي موجود يصير بالاوتو اميون ديزيز بالبرنيشيوس انيميا راح اتاك البارايتال سيل and cause decrement in intrinsic factor and this is cause deficiency of B12. Okay.
واضح دكتور.
زين what is thought to cause pernicious؟ اعتقد كلها جاوبناها هاي what is thought to cause pernicious anemia؟
ترى مثل ما قلت الاتروفيك جاسترايتس بسبب انه انتبودي.
Excellent. So it is autoimmune disease. ومثل ما حكينا
انتبودي هي اللي تهاجم برايتال سيل وبالتالي يصير ديفشنسي بالانترنسيك فاكتور.
عافيه. فانه انت تريد تجاوبني تقول it is an autoimmune disease. والبارحه ذاك الاسبوع حكينا الاوتوimmune disease there is no full theory about how it's happened. So usually they think there is اكو انه احتمال فيروس يسوي مشابه للخلايا وجاي يسوي there is genetically susceptible individual لكن inflammatory bowel disease و there is environmental trigger. هاي اللي هو يصير بيها autoimmune. اكو واحد genetically susceptible واكو environmental triggers اللي يسبب لنا الاوتو اميون ديزيز. اوكي، whether بالpernicious anemia, whether inflammatory bowel disease, whether in asthma. هاي هي theory most applicable and most understandable about inflammatory bowel disease. Certain genetically susceptible individual with environmental trigger, whether virus, bacteria, trauma, whatever the environmental trigger, and cause autoimmune disease. What a clinical sign may present if the disease process is advanced? Okay. أريد واحد يجاوبني على هذا السؤال على مود نروح للسؤال الكيس الأخيرة.
دكتور سيفير انيميا تصير
أي.
ممكن تؤدي الى هاي اوتبوت كاردياك فيلر.
Excellent. This is one of the explanations. So it can lead to severe anemia, and the severe anemia can cause heart failure. Okay. What others?
دكتور ممكن يسوي نيرف ديجنريشن يعني هو يساعد بناء النيرف.
Excellent. So nerve degeneration can cause peripheral neuropathy. زين يسوي بلاستيزيا، يسوي بعد شنو more specific about B12 شو يسوي؟ هي الكيس كان عندها كيس الكومبليننج مالتها شنو كان؟
يا دكتور ويت لوز وسورينج تونج.
هاي كلها features of يعني sore throat is a feature of anemia due to glossitis. بس هي شنو المين كومبلين؟
هي كان جاي unsteady يعني unsteady on her
Okay.
feet over the last month.
She became a bit unsteady on her feet over the last month. This شنو unsteadiness؟
يعني عندها neurological complications.
أي. So pernicious anemia is responsible about balance. Sorry, B12 is يعني يحتاجون للنيرف وخصوصا المايلين شيت الموجوده بالنيرف. فاذا صار pernicious anemia راح يصير demyelination of the nerve, and this is cause inflammation of the nerve. وهذا الانفلاميشن of the nerve, especially the high speed nerve, as you know, I don't know if you know the fast nerve contain myelin sheath, covered by myelin sheath. So فأي واحد عنده B12 deficiency إذا سيفير راح هاي المايلين شيث تتآكل وتروح، فيصير النيرف الكوندكشن مالته مو هالقد، مو جست بالبريفرال نيرف، كذلك بالسنترال نيرف. إذا صار السنترال نيرف راح البيشنت يصير عنده انستيدنس أو شعور بالفيرتايجو، زين، يحس الدنيا تفتر بيه، من يقوم يريد يوقع، زين، due to B12 deficiency. Okay.
دكتورة لو زحمة صارت شنو كان سبب قدر؟
يعني يعني شنو تردين اوضحها زينب؟ شنو سؤالك العفو؟
دكتور اكو كلمة قلتها بس ما لحقنا نسمعها. ستار ثروت قلت يصير بسبب فد شي بس ما سمعنا شنو قلت.
glossitis.
شنو يعني دكتور هاي؟
Glossitis is an inflammation. Gloss is tongue. Glossitis is inflammation of the tongue.
عاشت يديك دكتور، شكرا.
Okay.
واضحة عاشت يديك دكتور.
Yeah. What is the next question? انتوا تفتهمون هذا حكي له يعني I am far away from you. يعني واضح لكم كلكم تقريبا 185 طالب، انا ما اعرف البقيه يفتهمون هذا الكلام لا يعني احنا
واضح دكتور واضح.
حلو اوكي، لان يعني جاي احاول اوكي يعني انا جاي احاول انه انزل ايش قد ما اقدر على مود ارضي كل المستويات.
دكتور واذا ما نتم نسألك احنا.
اوكي، محمد جاي يبكي هسه ما اعرف ليش، يبكي من الفرح يبكي من اوكي let us see the next question. شنو التريتمنت مالتها؟
دكتور احنا قلنا انه المرض هو عبارة عن فيتامين بي 12 deficiency، لذلك ممكن الفيزيشن ينطي intramuscular B12 سوري injection، او ممكن ينطي orally يعني high dose oral vitamin B12 supplement، ممكن ياخذه يكون في شيء effective يعالج pernicious anemia.
حلو، عاشت ايدك. بس اضيف المعلوماتك، احنا اذا صار نيرف ديفيشنسي ما راح نقدر ننتظر انه ياخذ اورال يعني تابلت، لان احنا عندنا لازم نعطي وات از كولد بولس مانجمنت واكو مينتنس مانجمنت. فاحنا اذا واحد وصل الى مرحله الانستيدنس او سيفير انيميا نعطيه اي في انجكشنز.
نعم نعطيه انجكشن
انتراماسكولار انجكشن او سيانوكوبالامين. سيانوكوبالامين هو البي 12 زين، او هيدروكسي كوبالامين زين.
زين
من يعني يعبر مرحله الخطر اخليه على maintenance treatment for 3 months. So you have to give the patients IV or intramuscular injection when there is a severe B12 deficiency. اوكي.
نعم يعني دكتور
قبل لا نعوف البي 12 شنو التايب اوف انيميا ان بي 12 deficiency؟
دكتور ماكروسيتيك انيميا.
Excellent. So it is macrocytic anemia, increase in MCV. يعني من تقرون الهيموغلوبين تلقوه لو، تروحون على MCV تلقوه هاي، يعني فوق ال 96 فوق ال 100 دائما تلقوه زين. اوكي.
نعم يعني دكتور مثلا الشخص مثلا اللي عنده فيتامين دي ديفيشنسي عادة لما يروح يحلل ويطلع عنده ديفيشنسي ينطوه فد علاج يكون دوزه كلش عالي، الفيتامين دي كلش يكون دوز عالي بحيث 1 بول بير ويك، يعني ياخذ بس قرص واحد بالاسبوع ويعني عادي يمشي الوضع. فأنا يعني على هالأساس
تعرفين ليش هذا اللي جاي يصير؟
ليش؟
ليش؟ احنا جاي نتعامل غفران، احنا جاي نتعامل ويا pernicious anemia وجاي نتعامل ويا بي 12 deficiency اللي هو عنده مراحل الابزوربشنز.
نعم
هاي المراحل يمر عن طريق الانترنسيك فاكتورز، واذا اكو اوتو اميون الانتي بودي الموجود بالاوتو اميون ديزيز غالق هذا ما عنده انترنسيك فاكتور، فانت من تعطيه اورالي هذا البي 12 ما راح يصير بي ابزوربشن لان انترنسيك فاكتور ماكو.
صحيح
على مود تتصل. فلهذا احنا شنو نعطي دايركتلي تو ذا بلاد على مود هذا
صح
bypass this process to go to the tissue directly. بينما الفيتامين دي ديفيشنسي انا ما افكر عندي محتاج ديفد انذر ماتيريالز ما عدا احتاج الفات ما عنده يعني abnormality in bile لان as you know the vitamin D is one of the fat soluble vitamin او decrease راح تاخذون ان شاء الله اخذكم بالسنه الرابع او الخامس على مود ابين لكم شنو when it happens the vitamin D deficiency ليش بالليفر ديزيز يصير فيتامين دي deficiency وراح تعرفون هسه مو موضوعنا ان شاء الله. زين. السؤال الاخير من يجاوب لي يا عافيه يا شباب؟
نعم دكتور عندهم good quality of life.
Yeah. So the answer yes. Do this allow the patient to have a good life, quality of life? Of course, yes. When we have like the patients diagnosed in early stage and we replenish the B12, نعطي the B12, so it will have a normal life, good quality of life. Okay. نجي على الكيس الأخيرة يا شباب لأن الوقت جاي داهمنا وصرفنا هواي وقت وياكم. زين والكيس الأخيرة هي موضوع الليكتشرز مالتنا. يلا أوكي من يقرأ لنا إياها؟ Hello guys. Still there?
Dr. Gill is a 37-year-old teacher who attends her GP surgery complaining of ongoing diarrhea, which she has just noticed contains blood and mucus. It is this that has prompted her to book in. She also reports that she has also been suffering with lower abdominal pain and has been feeling generally unwell and tired for the last 2 months or so. She does not take any regular medication, but has tried some over-the-counter medications to reduce the diarrhea with little effect. The GP does a rectal examination and notes that there is no perianal disease, but there is fresh blood in the rectum. List three different possible diagnoses.
Okay.
دكتور يجوز اسمه ulcerative colitis.
Okay, ulcerative colitis on the top of the differential diagnosis. What else? What other two?
يجوز Crohn's disease.
Crohn's disease. Okay, why not? What others?
دكتور ischemic colitis.
Ischemic colitis. Okay.
دكتور الفاريسيس اقدر اقول؟
بس او الاسكيميك كولايتس ليش انت خليت الاسكيميك كولايتس بالموضوع؟ Who's said ischemic colitis?
دكتور احتمالات كانسر.
Cancer, yes, malignant colon cancer. I agree, totally agree. What others? So just who's telling me that? Who's told me that there is
دكتور
ischemic colitis?
دكتور انا قلت لك يجوز عندي شو اسمه دكتور ما انا عندي نقص بالبلود فلو.
شنو اللي عندك؟
ممكن يصير.
Why? شنو risk factor? I agree with you. It could be ischemic colitis. But what is the scenario that make you think this is ischemic colitis?
هو ضمن يعني اللي suggestion، بس اذا هي عندها نقص بالبلود فلو فممكن يسوي لي اسكيميك كولايتس.
Okay.
دكتور lower abdominal pain عندها؟
Look guys, I hope I will meet you if we don't catch up by coronavirus in the next few years to let you know how to approach patients with diarrhea. So diarrhea, when you think about diarrhea, you have to think about all situations. This is a young young age teachers. So the young age teacher, unless the patients have a risk factor for ischemia, you put the differential diagnosis of ischemia at the last and at least the last most your differential. When I present this case and I hear from you guys that you have ischemic colitis, you give me the ischemic colitis initially as a differential diagnosis, you will be in a big trouble because no one of you telling me this is a case of infectious diarrhea. So infectious diarrhea, which is we are endemic in infectious diarrhea by virus, by bacteria, by a lot of things. So why not this is infectious diarrhea? This is the top priority because we are endemic in microorganisms like typhoid, TB, like E. coli, a lot of microorganisms present in our society, and we are not a hygienic environment. We are not a sterilized environment like Western countries because we are endemic the water is not well sterilized. There is no sterilization, good sterilization of food. We just buy food from the groceries, and the grocery buy the food from the farmer directly. There is no sterilization. The food and the fruits doesn't enter the, like, especially the vegetables and the fruit doesn't enter like in factories that make them clean and hygiene like the Western countries. When you go to the Western countries, no food will be sold directly to the customers unless the patients or the persons go directly to the farms. Usually they go to the factories that they wrap them and they clean them and then they sell it in the market. This is the usual process happening in the Western countries. While in our societies, it's usually the case is completely different. We are an endemic environment. So the first priority that you have to give me is the infectious diarrhea. So when we list this differential diagnosis, you have to tell me the top priority or top differential diagnosis that available in this scenario is the infectious diarrhea. Okay, and then like the other differential, like inflammatory bowel disease, malignancy, ischemia. There is no risk factor. Yes, I agree. It could be ischemic colitis or ischemic mesenteric ischemia, but think about the differentials. The case doesn't give you like a shock state, decrease in blood pressures, or there is atrial fibrillations, or any increase in thromboembolic phenomena that make you think in ischemia. I'm not sure if you know all of these diseases like atrial fibrillations or thromboembolic phenomena, but or shock state. But just stick with the condition. So usually when any patient presented with you with a bloody diarrhea and abdominal pain, initially think about infectious disease, and then think about the inflammatory bowel disease, and then tumor or malignancy, and then put the others like the others differential in the list in your differential list. Okay, does that make sense for you guys?
نعم دكتور.
Okay. So let us go to the next question. So what is the most likely cause of this patients, of this case scenario?
دكتور ulcerative colitis لأنه fresh blood.
Fresh blood, ulcerative colitis. Why it is
دكتور اتوقعنا infection.
Okay, so I need you now to think about why it is ulcerative colitis, why it is not, from the case scenario.
diarrhea, دكتور. Diarrhea
So,
or blood, دكتور.
So bloody diarrhea is happening only in ulcerative colitis? So it can happen
دكتور بسبب فريش بلاد دكتور.
يعني fresh blood just only in hemorrhoid can cause fresh blood.
دكتور لأنه يعني أكو الساينز مال Crohn's disease ما موجود يعني مثل weight loss, anemia.
Okay, that's good. So weight loss.
بالنسبة للهيمورايد مسوينا rectal examination ما لقينا هيمورايد.
Okay, why not? I agree with you. But internal hemorrhoid usually not excluded by just PR examination. Keep in mind. Just the external hemorrhoid, you can surely exclude the external hemorrhoid by PR examination. Okay, the internal hemorrhoid, you are not able to exclude internal hemorrhoid by just PR examination. You have to do colonoscopy. You have to send the patient for myself in order to do the colonoscopy, and then I will let you know if she got hemorrhoid or not. Okay.
دكتور بس دكتور ليش اكو ينكس بالدائرية؟
Mucus, because there is an inflammation of the colon. So guys, why do you think
دكتور يعني الميوكس هو اللي يقول لنا انه هاي مو انفكشن؟ يعني هاي صار انه بسبب انه اوتو اميون انفلاميشن لو شنو؟ يعني انت قلت لنا انه اول شيء نفكر به انفكشن وراها نفكر مثلا اي بي دي، بس انه هنا ليش ما قلنا انفكشن انه هو السبب؟ ليش قلنا انه اي بي دي هو السبب؟ يعني شنو اللي خلاك توصل لهذا الاستنتاج؟
Why do you think this is what I need you to think, Zainab? Why do you think this is IBD more than the infectious conditions?
دكتور يعني سبتم وساين ما موجودة، مثلا الانفكشن فيفر ويطلع بها مرات وغير ساينز ما موجودة.
دكتور صار لها 2 months.
Excellent. This is the answer. So usually the infection doesn't last for 2 months unless there is a complications.
Hey, doctor.
So usually it is when I give you the lectures for diarrhea in the next 2 years, I will give you that there is one of the stepping margins to differentiate between the acute and chronic diarrhea is the durations. The duration is very important because when you think about infectious diarrhea, usually it lasts just for 1 month and below. So you have to think about the causes of acute, but still the possibility of infectious diarrhea could be the possibility, because there is what is called persistent infectious diarrhea, because like either immune debilitated patients, like patient on steroid or on chemotherapy or patient with cancer, when they got the infectious diarrhea, the infectious diarrhea persists for them for a long time. So they stick with them for a long time. And there is unusual microorganism that can cause chronic diarrhea, and they miss the treatment, like fungal infections, some rare bacteria that we miss the diagnosis of them, and that is why the infectious diarrhea happen for long times. Otherwise, usually in the typical situation, the infectious diarrhea lasts not more than 1 month. While if you took the history from this patient, if you see the case scenario of this patient, the conditions last for 2 months. The patients have 2-month history of bloody diarrhea and abdominal pain. So you have to think about other causes of the bloody diarrhea, which on the top priority of them is the ulcerative colitis. Okay?
اوكي
والله دكتور.
زين. يقول الجي بي دزها الكولونوسكوبي. ايش راح تشوفون بالكولونوسكوبي؟
دكتور نشوف الساينز مال شو اسمه مال الألسراتيف كولايتس، مثل كونتينوس، سوبرفيشال، اكو بليدنج.
خوش. بعد اكو واحد رامينا.
دكتور بوليبس اكو صايره الريجنريشن مال السيل.
اكسلنت. هذا
weirdly regeneration of cells.
دكتور احتمال كريبت ابسس.
هذه كريبت ابسس تشوفها وين؟
بالهيستولوجي.
بالهيستولوجي.
دكتور نقدر نشوف انه اكو ستينوسس صاير او ستركتشر بيه؟
ستينوسس والستركتشرز هاي بالالسراتيف كولايتس ما تشوفين ما تشوفين شو اسمه
بس بالكرون؟
only بالكرونز. you can see the like swallowing, but it is not swelling, but not the narrowing strictures. Usually the strictures happen either in malignancy or Crohn's disease, not in ulcerative colitis. Why? Do you know why?
دكتور يعني الألسر ما يصير لها هيلينج، شو هو اللي كان ما يصير
superficial يعني superficial inflammation.
عافية، لأن بس affection mucosa not transmural. So Crohn's disease is transmural, while the ulcerative colitis يعني present or have just a mucosal disease. Okay. أنا جاي أنقل لكم شوية صور، هل شوية أتأخر بالجواب. جاي أحضر لكم صور للديفرنس لهذا السؤال حقيقة، لأن تحتاجون تشوفون الاندوسكوبي فوتوز مال أي patients. Okay. So let me show you the photos for the colonoscopy for patients presented with the ulcerative colitis. Okay, I will try to just keep in second. Let me present this. Still presenting. Present a window, and you can see. You see this photo. Guys, do you see this photo?
إيه دكتور موجودة الصورة.
هذه الانفلاميشنز، هذه inflamed colon. Do you see this photo? Another photo?
نعم دكتور موجودة.
اي دكتور واضحة.
هاي الفوتو هسه قدامكم هي صورة النورمال كولون. تشوفون normal mucosa. This is normal. There is no erythema. Pale mucosa. You see the vascular marking clear, and there is no bleeding. There is no ulceration. There is no granularity. But if we go back to this photo, do you see the vascular marking here?
اي دكتور.
وين
Do you see the vessel?
لا ماكو دكتور.
ماكو vessels. The third sign of inflammation, there is loss of the vascular marking on the colonoscopy. As I am an endoscopist, من اسوي واحد كولون اول شيء اشوفه هذا severe inflammation. اول شيء اباوع على الفاسكولار ماركينج. اذا بعد ما اشوف الفاسكولار ماركينج هذا initial sign of inflammation. ثاني شيء جاي يشوفون الارثيما. اعتقد هاي الارثيما اللي قدامكم is like هاي المناطق الحمراء. هاي another sign of inflammation. بعد اذا تشوفون هاي نصيح له granularity. جاي تشوفون المنطقه مثل المحببه swelling congested، مو مثل هاي الصوره اللي هي normal clear mucosa. There is no swelling, there is no loss of vascular marking, there is no erythema. While here there is granularity, congestion, erythema, loss of vascular marking, and if it is so severe, there is ulceration here. So this is what we see usually in the colonoscopy. Happy with that, guys?
هبي دكتور هبي.
Okay. I hope you're always happy. Okay. So, next question.
بس العفو دكتور بلا زحمة، قبل لا ننتقل للسؤال شو اسمه الثالث دكتور، بس تقدر يعني توضح بصورة أقوى دكتور ليش قلنا هاي ulcerative colitis ما قلنا هاي كرون ديزيز يعني؟
I think you have to answer this question for me. من يحكي وياي الثاني صورة من
دكتور حسن ناصر حمزة.
منو the ask this question.
دكتور انا حسن ناصر حمزه.
حسن المفروض بيك انت تقول لي يابا هذا، لان انت حضرت المحاضره last week you know better than me in her information and information. ليش قلنا عليه ulcerative colitis هذا الكيس سيناريو؟ ليش ما قلنا Crohn's disease؟ تقدر توضح لي حتى لو كلمه كلمتين لقيتها بالكيس سيناريو انه ليش قلنا Crohn's disease؟ ليش قلنا ulcerative مو Crohn's؟ Anyone of your colleagues can answer this question?
دكتور يعني شو اسمه انه البلادي دياريا موجوده هم ابدومينال بين، يعني شو اسمه نفس تقريبا نفس الكرون ديزيز يعني
دكتور هنا كونتينيوس صار الانفلاميشن هذيك سكيب، وشغله انه هنا ما صار اكو ستينوسز هناك، انه
لا
بسبب
لا بس العفو يعني شو اسمه لا يعني الهيستولوجي ان شاء الله لا فهمته من عندك يعني دكتور. لا بس اقصد يعني اول شيء يعني لما قلنا اول شو اسمه مثلا اعطينا ثلاث احتمالات ممكن تكون بالدايجنوسيس. قلنا هي شو اسمه ممكن ulcerative colitis، ممكن كرون ديزيز، ممكن هي هاي شو اسمه تيومر. بس ثاني سؤال دكتور يعني ليش شو اسمه قلنا ulcerative colitis يعني دكتور؟
اي اوكي زين. يعني اريد تعرفون اكو تيبل طلعت لكم اياه وعطيتكم اياه البارحه وحكينا عليه ثرولي. شنو المين برزنتيشن اوف Crohn's disease؟ typical presentation. بالبرزنتيشنز or the symptoms شنو فرق الكرونز ديزيز عن ulcerative colitis؟ anyone can help me؟
دكتور قلت انه يجي انه صار عنده ويستنج muscle wasting، كنت تعبان، حكيت لنا عن هذا انه عمره 17 اجاك العيادة ودياري عنده يصير وبين.
Okay, good. So usually the Crohn's disease presented with abdominal pain and on and off diarrhea with weight loss. This is the triad of Crohn's disease. Rarely presented with bloody diarrhea. Rarely. It can cause, but rarely present with bloody diarrhea. The usual manifestation of bloody diarrhea is ulcerative colitis. شو وقت Crohn's disease يسوي لنا bloody diarrhea? When it is involved the colon. And as you know, I told you the most common site of Crohn's disease is terminal ileum. It can happen anywhere from the mouth to anus, the Crohn's disease. But keep in mind, Crohn's disease, the most common site of Crohn's disease is the small intestine. And the most commonest site is the terminal ileum. That is why the terminal ileum is when it is affected, it just causes abdominal pain, and then it causes weight loss because of malabsorptions, and it causes like diarrhea on and off. But never ever, sorry, it is not never. Rarely, it can cause bloody diarrhea unless the Crohn's disease involves the colon. I'm not saying that Crohn's disease is not manifested as bloody diarrhea, but the typical presentation of Crohn's disease, which is usually missed, and usually missed because it happens in a young age group, and they think it is irritable bowel syndrome, because it is just present with abdominal pain, abdominal colic, and weight loss. There is a feature of malnutrition, as your colleague said. So there is features of vitamin deficiency, feature of anemia, while the ulcerative colitis is presented with anemia and it is not really to be affected by small bowel. So there is no features of vitamin deficiency. Only cause anemia when there is a huge blood loss and the patient doesn't go to the doctors to refresh his treatment and stop the bleeding and inflammation from happening. So this is what I need you to know. The presentations of the patients goes with the ulcerative colitis because it is a typical presentation of ulcerative colitis, bloody diarrhea, there is no anemia. And in addition, when the rectal examination, he said there's perianal examination was normal. And as I said yesterday, Crohn's disease, if it is present, usually they have like perianal manifestation, like fissures, fistula, and tags, etc. So this case scenario, you have to tell me, all of you guys will tell me this is a case most typically goes with the ulcerative colitis. But Crohn's disease, yes, can happen in this scenario. But the typical presentation of this case, 100% applicable for ulcerative colitis. Does that make sense for you guys?
شكرا جزيلا دكتور، إن شاء الله كلش واضح.
Okay. So the next question. Gil has a friend from work and who suffer from Crohn's disease and asked hospitals consultant if what she has is very similar. The consultant explained, putting Gil's presentation into context. I think you guys have all these يعني التيبل اللي اعطيتكم اياه يحب كل هاي الاشياء. So يعني ماكو داعي نروح له لان هو موجود عندكم اوريدي. اوكي، اكو واحد عنده سؤال او استفسار على هذا التيبل؟ هو نفس التيبل اللي اعطيتكم اياه، بالعكس التيبل اللي اعطيتكم اياه اكثر بمعلومات. اكو واحد عنده استفسار؟ اكو واحد ما يعرف يجاوب هذا السؤال؟ No response.
لا دكتور.
Okay. Given السؤال اللي بعده, given the likely part of GI tract Gill's condition will affect, will there any fat or vitamin malabsorption and why? اعتقد جاوبناها قبل شويه.
دكتور ماكو fat or vitamin malabsorption.
ليش؟
لانه باللارج انتستين والفيتامين والفات بالسمول انتستين.
affect the large intestine and rarely involve the small intestine. Okay. السؤال الأخير, is there a potential cure for Gill's condition?
دكتور توتال
Anyone can help me in answering? We just have total colectomy, guys. I give you a list of medications. If I send all my patients for total colectomy, I will not be a good gastroenterologist. This is I doubt this answer for you. Who's telling me this answer, guys?
دكتور إنه قلت لنا ننطي إنه كورتيكوستيرويد مثلا immunomodulator ننطي biologic agents.
Since I came from Australia in the last years, I have like 40 patients with ulcerative colitis. I have 40 patients with ulcerative colitis. Most of them they have cured from. It is not. When I mean cured, they have clinical remissions. They have histological remissions. They are in remissions.
قلت لنا علاج إنه 5 SM.
Yeah. So most of them, I think I have 1 or 2 severe cases. Till now, I haven't sent for all of them for total colectomy. Total colectomy is the last resource. آخر كارد الحرقة ويا المريض when they have like a severe pancolitis and they are unable to. We are unable to manage these patients properly with the medications. So, but most patients with ulcerative colitis treated well with the usual medications, and they have near cure and they are in good remissions. But the total colectomy is the last resource that we put the patients through when we failed giving the patients treatment and we heal the patient by treatment. Okay.
Okay, Doctor.
Before I will send you the link for the quiz, anyone have questions about these answers or have query about certain?
دكتور أنا زحمة عادي نمتحن يعني نسوي الحضور وبعدين نسأل لأن نخاف العشرة تنطفي الكهرباء، فإنه بس خلينا نجاوب نسوي الحضور حتى بعدين نسأل عادي لو زحمة.
العفو، يعني شنو قصدك؟
دكتور يعني أول شي خلينا يعني أخذنا الحضور ونسوي الامتحان بعدين نسألك، يعني يصير هذا الشي؟ راح تطفي الكهرباء.
I don't care about the attendance زينب. انا ما يعني لا، حتى الكويز انا راح ارسل لكم اياه بلينك وانتم جاوبوا. زين، اريد الجواب هسه، يعني جاوبوا بدون اخذ الحضور. انا ما I don't care about the attendance. اوكي، بس اريد واحد من عندكم ياخذ الحضور زين ويدز لي اياها.
دكتور بس بتسألك
راح
سؤال.
اخلي اللينك
بلي.
راح ادز لكم اللينك. هذا اللينك تقريبا دزيته لكم مال الكويز على الشات مال الجوجل رايت ناو. اذا اي واحد يدخل عليه ان سؤالين جاوبوا لي اياهم زين ودزوا لي اياهم راح يوصلن الايميل وانا اصلح لكم اياهم. اوكي، راح اعطيكم كل واحد فتح السؤال.
نعم دكتور فتح.
خوش، هسه راح اعطيكم فد 5 minutes for answering these two questions. Okay, happy with that?
دكتور 10 دقائق.
10 دقائق، يلا لا تضوج. يعني اتوقع انه كلهم راح يوصلن لي within 10 دقائق للايميل مالتي. اوكي، واذا راح ادز لكم الانسر later on. اوكي عيني، يلا انا راح I leave you. If you have any further question just chat with me later on. Okay.
ماشي دكتور ماشي.
يلا في معنا.
الله يعافيك دكتور.